Good morning, everyone. Welcome to the Workers' Mic right here on 720 WGN, powered by the Midwest Coalition of Labor. My name is Ken Edwards with the MCL. Sitting to my left is Ed Maher, as usual, with the International Union of Operating Engineers, Local 150. Good morning, Ed.
Good morning, Ken.
How's it going?
It's pretty good. I'd rather be home on Father's Day, but, here we are.
We are both fathers.
That's right.
Yes.
But we've got important work to do here today.
Yep, and I want to get right to it because I know we have a packed show today. But I know that you went to another writers and SAG-AFTRA picket.
Right. So the screenwriters held like an International Day of Solidarity. And so in Chicago, what that looked like was on Thursday, there was a demonstration outside of CBS over by Daley Plaza where you had the writers, you had SAG-AFTRA,
Right.
and, other unions that were out there in support, just holding signs and calling for a fair contract.
And it seems like SAG-AFTRA and the writers obviously have a lot in common, right? It sounds like their wagons are hitched a bit. And I got to say, I just want to get right to this. SAG-AFTRA, Writers Guild,
Yep.
Directors Guild,
All have contracts that are
IATSE,
expiring.
Teamsters, anybody that's working in this industry, you're going up against multinational, multi-trillion-dollar industries, and you're doing it by yourselves, one at a time.
Yeah, you can go up against multinationals and win. It's been proven many times that you can, but you have to. You've got to band together. The first three unions that you mentioned were the Writers, SAG-AFTRA, and the Directors Guild.
Yeah.
So the Writers' contract expired at the end of April. I want to say the Screen Actors, their contract expires at the end of June, as does the Directors Guild. So the idea is that you wouldn't just have writers on strike. You'd have writers, you'd have actors, you'd have directors. So nothing can happen.
Everything would come to a screeching halt.
Right.
And, unfortunately, in my humble opinion, the Directors Guild, which I think is probably the smallest out of all of them, cut a deal with the, what's it called? AMPT, blah, blah, blah.
Say a couple more letters.
I don't know. It's like AMTT, AMTPPO, whatever. And that is like they
NAMBLA.
have an association. No, did you just say NAMBLA?
NAMBLA.
Oof.
So,
listen, they have an association, right? The corporations, right, which are all by themselves big enough to take on most of the entire world. They got together and they formed a coalition. So when they bargain as a coalition.
Yeah.
You're not talking like you're literally bringing a knife to a gunfight. So what I'm saying is, first of all, you should all get together.
Yeah.
Right? I mean, that's just my opinion. Look, we have building trades. We have
that happens all the time.
Contracts with the city of Chicago, right? We have what's called the Coop Agreement. All the building trades negotiate, negotiate together, right? Makes sense. Strength in numbers. But the Directors Guild cut a deal.
The Directors Guild has a reputation of being sort of a company union.
Oof.
Meaning, and that's what I heard from folks that were out on the street the other day, because my thought on it is, by the end of June, you're going to have directors, actors, writers all out of work. You can unite together and bargain together, because the idea for the motion picture industry would be to try to cut a sweetheart deal with one,
of course,
and then say, hey, these folks are coming back to work. You need to cut a deal soon.
And then shove it down everybody else's throat.
Right. And it appears like that's what they've started to do, because they reached an agreement with the directors that I think the Directors Guild members have to vote on.
They're voting, I believe they're voting right now, and I'm not sure if there's a mail ballot or it's internet, but there is a movement to vote no. And I got to tell you something. One of the, in my humble opinion, a poison pill in that agreement, because now that they are voting, they put the agreement out in public. And I'm not going to get into the weeds of whether the money's good, bad, and different. I don't know. I don't care. Not that I don't care, but I think they make good money. The poison pill is AI,
right?
And you know what the agreement says?
What's that?
I'm paraphrasing, but it says this about AI.
Yeah.
If we want to use AI, we'll talk to you.
Oh, okay.
That's it.
We'll talk to you.
Yeah. So let's
like if I'm going to fire you, I'll tell you.
Okay. So you're Steven Spielberg.
Hi,
right?
Hi, Ken. My name's Steven. Nice to meet you.
Yeah, I'm the AMTT. Blah blah blah. Hey, we're going to use AI. End of discussion. No, that's it. No, that's it. That's it. We're done. I just fulfilled my contractual obligations. We just had a discussion. But it was just in the hallway.
Yeah, that sounds like a really, really terrible...
Hey, DGA, vote no on this contract for that exact reason.
Yeah.
A discussion is not negotiations. A discussion is it literally could be you're sitting next to somebody in the stall next to you and go, hey, by the way, we're going to be using AI to replace you. What? No, you're not. You can't.
Right.
We have a contract. Yeah, your contract says discussion.
Yeah.
And discussion is not negotiations. You should vote no on that contract.
Yeah, and I know SAG, the Screen Actors Guild, they're standing pretty strong here, and I think they understand that the reality here is they have the power to tell the studios, hey, you think you can do this without writers?
Yeah.
Let's see you do it without writers and actors. And that's exactly the way that they should be taking this, because this is a serious fight.
Yeah.
And I love to see the solidarity. I'm just hoping everybody stays strong. And
it would be great if the Directors Guild votes no, gets together with the Screen Actors Guild and the Writers Guild, and they all get on the same page, and they all push for the same thing.
Right.
And the other thing is, stop asking for these piddly amounts of money. And I'm talking to you, Writers Guild. They asked for $400 million or whatever that number is. It's a joke. It's half of one of the CEO's yachts.
Right, and
$400 million. You should ask for $4 billion, $5 billion. This is a multi-billion-dollar industry. Ask for what you deserve.
Yeah,
you deserve a giant revenue share in that because you're the ones that are creating it. Period.
Right.
The end. And all you're doing is creating wealth for the top 1% of 1%.
Right.
Right.
Yeah.
You should ask for more money.
So getting into what we have to look forward to on today's show. Over the next couple of weeks, we're going to be focusing on some of the professionals that are promoting healthcare for union members and just in the healthcare field around the Midwest. So
we're gonna stop second guessing the entertainment industry unions.
Well, I think we second guess them, and we will continue to second guess them as we have for the last month. But on today's show, we are going to have Maria Romano. She's with Premise Health. She's the vice president of health equity and medical informatics, talking about some really, really interesting things like food insecurity and what health equity
things that
means.
You've been talking about for a couple of months now,
Yeah,
right?
and
about children, not being able to afford school lunches.
Right. And so stick around for that segment. That's coming up next because you'll learn a lot. I expect that I will as well. And then after that, we'll have Adam Dell. He's the director of emotional well-being at Notre Dame Wellness Center, and that's going to be about mental health. Which
he's also with Premise, right?
Right, with Premise Health. So we could learn, we can learn a lot from him. But stick with us. It's going to be a great show today, and we'll be right back after these words. Right back here on 720 WGN.
Welcome back, everyone, to the Workers' Mic right here on 720 WGN, powered by the Midwest Coalition of Labor. I'm Ken. Sitting next to me is Ed. And as we were talking earlier, we are very pleased to welcome to our show Maria Romano from Premise Health. Welcome, Maria.
Thanks, Ed. I'm happy to be here.
Hey, so tell us real quick, you are the vice president of health equity and medical informatics.
With Premise Health.
With Premise Health, correct?
Exactly.
And that is that's an enormous title with a lot of big words. So let's start with this. First of all, where are you from, by the way?
Originally, I grew up in Connecticut, but I am now based out of Miami.
Ooh, very nice.
Nice, good for you. Lucky you. Smart move.
Yeah.
Get away from the cold.
So health equity is kind of a buzzword I hear a lot more in the healthcare industry. How can you explain to us what health equity means?
Absolutely. I spend my days doing this. You'll often find that people say equality and equity, and they think they mean the same thing.
Mm-hmm.
But equality really means everyone gets the same resource or the same opportunity. But the same resource or opportunity doesn't necessarily fit for everybody. So the way I like to explain equity is if equality, let's go to equality actually. If everybody gets the same bicycle,
mm-hmm.
some people might find it too big. Some people might find it too small, and some might not even be able to ride it.
Right.
But if we were able to give everybody a bike that's tailored to their needs, everybody could ride.
Yeah.
And so equity is understanding what people need.
Interesting.
And giving them what they need to enjoy a healthy life.
Each individual. So as opposed to one-stop shopping or one-size-fits-all, your model is, and I think Premise's model, and I think this bears out through our health centers, is you're talking to that particular individual member that's coming in, and you're seeing what he or she or the kids or whoever needs themselves, and then you go from there.
Exactly.
Yeah, it is a it's not a fee for service model, right? Like explain that, like the difference between a premise health center and somebody going to, a doctor's office, for example.
So, when people say fee for service, there's a huge difference. There's fee for service.
Yep.
And that's the traditional model.
Mm-hmm.
And then what ours is the value-based model. So it's a critical difference. In a fee-for-service model, providers are getting paid to every test and procedure that they order, they make more money.
Yeah.
Right.
That leads to unnecessary treatments, driving up costs. And in contrast, what Premise Health does is we're a value-based model, and we get rewarded for our services that are quality-based and quality-focused on health outcomes instead of individual tests.
I think when, and that's a really good explanation. I think when Stu Clark was on a few months ago, he said, it's not the traditional, what do they call it, the doorknob?
Yeah, the doorknob hanger or something like that.
Yeah, like the doctor's hand is on the doorknob. He comes in for a second, looks at you and goes, yeah, everything's good. I'll see you later. And hey, doc, my heart's beating kind of, I'll see you later.
Right, yeah, make another appointment.
Yeah, talk to my secretary. So yeah,
exactly.
so one of the things that we want to turn your attention to and want you to discuss is something that we've been discussing here for a while now, and that is food insecurity, and particularly as it relates to children and the free meal programs and ed.
So I know, Maria, one of the things that I had read about your work was that food insecurity is one of your major focuses, and we've talked on this show several times about over the past few months. I think now 6 states have passed laws to give universal access to free lunches in elementary schools, and this is something that children have been gathering and taking collective action to secure for their friends and their classmates that they know don't have resources to do this. But the federal government, the House GOP, actually just put out something this week that said one of their goals for next year is going to be banning these free lunch programs because they're abused, and people who don't need free lunches, who can afford to buy lunches, are going to be getting free lunches. And I mean, the whole idea sounds crazy to me because, and we're talking about kids in school here needing food and nutrition to be able to perform and function and learn. But I mean, in the larger kind of universe here, how does food insecurity work into healthcare in your practice?
Well, that's a great question. Food insecurity is one of the parts what we refer to as the social determinants of health. So where are you born? Where do you live? Where do you learn? Where do you work? Where do you play? Where do you pray? Right? All of those things are called, SDOH. And so
SDOH. So
social determinants of health.
Social determinants of health. I like that. And so all that stuff factors into your health. Let me just stop here for a quick second. You wouldn't think that, like, hey, where I'm born or where I live have anything to do with, how long I'm going to live or what my health is. But you're saying that that's not accurate. They're actually, it's all this stuff affects your health.
All of this affects your health. There's research that supports that 50 to 80% of health outcomes is affected by your social determinants of health.
Wow.
So we're talking about the fact that your zip code is now more important than your genetic code when we talk about preventing disease, eradicating disease, or even, treating it. That's
amazing. That's amazing.
If right now, Deloitte just published a study, and they said that it's costing us $320 billion a year because we're not addressing health inequity. If we continue to ignore it, we're going to be at $1 trillion by 2040.
Wow. So your approach and Premise's approach, quite frankly, and I think this bears out in our health centers, is that you're looking at these social determinants and using that to provide health care, correct?
Absolutely. We ask questions. We've pivoted from just going, hand on the doorknob, right?
Yep.
We've pivoted. We ask questions that you wouldn't typically hear in a normal office out in the community. We ask things like, do you you have the resources to pay your electric bill?
Right.
What's your housing situation looking like right now?
Yeah.
What about access to healthy foods? Our goal is not to just, hey, here's a pill, good luck with that.
Mm-hmm.
We're trying to get to the root cause and change lives.
So back to the food. So I'm sorry to talk over you, but back to the food insecurity. So that would, I assume that would not only affect obviously the kid, but it's got to affect the parents as well, right? If their kids are insecure about food, chances are I would assume that means that they are as well, and that they might not have the money
Absolutely.
to care for their kids as well as they should or could. That's got to cause stress. It's got to cause time off of work, and I mean it's got to cause a plethora of issues. Can you speak to that?
Yeah. Absolutely. It's a resource strain, and when we talk about health equity and we talk about this sandwich generation where, people are having children at a later age, and now they're taking care of not only their children, but their parents.
Yeah.
And that stress, that financial resource strain is hitting hard. And there are about 6 million Americans that are dealing with that right now. So at Premise, what we did is we partnered with the largest social care network in the country, Find Help.
What is it called?
And we have a resource.
Can you say it again?
It's called Find Help. Find Help.
Find Help.
And I'm going to Find Help, HELP.
Yep.
And the way you can access the resource that we built with them is if you go to the website, findhelp.premisehealth.com.
Okay.
And if you did that right now, you would put in your zip code, right? Remember I told you zip codes are really important these days.
Yeah.
You can put in your zip code and you can find resources. I believe right now they have over 650,000 resources available throughout the country that address food insecurity. So we have food pantries.
Yeah.
They address behavioral health. They address housing. They address disease states. They even have resources for like legal assistance. So you can find just about anything using your zip code. I encourage you to go check it out. It's a great resource and a great partnership.
That's really cool. I didn't know it existed. And then this is once again, thanks for coming on and talking about this thing, because people probably don't know that this exists. And you can everybody's got a cell phone. You can get on your cell phone and go get it, right?
And
exactly.
I think it's really interesting to remember too that there are zip codes where people's medical concerns for their children are getting them braces so they can have nice straight teeth. And then a few miles away, it could be trying to find a way to provide 3 meals for their children. So if you're trying to talk to this kid who doesn't get 3 meals about, keeping his teeth clean or getting his teeth straightened, you're not talking to them at their level. So this, I really understand this theory of equity, and I think it's great work that you're doing. Yeah,
we really appreciate what you're doing. I think Premise, you guys are, as Stu has said, you're trying to disrupt healthcare, and we're seeing the results here at our clinics. I know that the carpenters, electricians, and various other unions are starting to build their own clinics. The MCL obviously is going to partner or has partnered with you guys, and we're building clinics as we speak. So all of this stuff is a great place to get your healthcare, I think, instead of the normal, like you said, whatever it's called, value-based or whatever that's fee for service.
Right.
Sorry. So this is really cool. It's really important. If they want to find anything else out, like where else would they go? Is it premise.com, or talk to me about that?
Yeah. Yes. So premisehealth.com. You can access it from any website, and you can learn more about what our company does. And what I do is one small part of all the other things that we are the disruptor of healthcare. We are on the right side of healthcare, and everybody that contributes through our company, we're looking to change things. It has to change. We don't have a choice.
It absolutely has to change. And kudos to the unions and the building trades, especially, that recognize this and are building these centers for their members, because we're seeing results. I mean, there's no question about it that we're seeing. My own personal story, which we'll get into. But yeah, we're seeing results directly from this model. So we really appreciate your taking the time to come on the show with us. We've been talking to Maria Romano, who's the Vice President of Health Equity and Medical Informatics for Premise Health. So thank you very much, Maria, for taking the time.
Thank you for having me.
Yeah, absolutely. We will be right back with more of the Workers' Mic right here on 720 WGN.
Welcome back, everybody, to the Workers' Mic right here on 720 WGN. And we're very excited to introduce Dr. Adam Dell, who is a clinical psychologist and the Director of Emotional Well-Being at the Notre Dame Wellness Center for Premise Health. So welcome. Thank you so much for coming on the show, Adam. Dr. Dell, pardon me.
Yeah.
What would you rather, Adam or Dr. Dell?
Dr. Dell.
Dr. Dell sounds pretty cool.
It does.
Yeah, double D, Dr. Dell.
Dr. Dell.
And he's also a father. He's also a father first, right? On Father's Day.
Yeah. Well, and I'll tell you, before I came to Premise, I served for almost 7 years in the Air Force. So I was captain and then Major Dell. And those are pretty cool titles as well.
Major Dell.
Major Dell sounds even cooler than Dr. Dell.
Yeah.
Wow.
But today, the most important title you have is Dad.
Yeah, good for you.
Happy Father's Day.
That is it. Thank you, guys.
So we're here to talk about behavioral health, right? And what Premise does and how you provide that to our constituents and your, where you work. And I know you work at the Notre Dame office, but this is sort of premise-wide, if you will, is we're starting to see more and more of our clinics, especially here in Chicagoland and the unions, start to add behavioral health to part of the benefits. And, just overarching, like, what does that mean in plain English?
Well, it's a good question. I think a lot of times when people in general, maybe men in particular, think about mental health or behavioral health, oftentimes we think about it almost from a medical model standpoint. You think about someone who may have developed a constellation of symptoms that might, look an awful lot like depression or anxiety, and then, they might seek health care on the basis of wanting to ameliorate that. Sort of like we'd go to a doctor for a number of other health-related concerns, saying, hey, this has popped up and I don't like it. And, I'd like a diagnosis and some treatment for this. One of the things I learned, immediately after getting my degree as an officer in the Air Force, and then certainly in an organization like Premise, where we're so passionate about helping people to be and stay well, is it's as much about sort of driving down the unwanted symptoms as it is increasing people in the direction of flourishing.
Mm-hmm. Explain that. What does that mean? Like, are people actually coming in to see you and saying, "Hey, doctor, I think I'm depressed or I'm anxious," or is it the sort of referral from down the hall? Which I think, I hate to say it, but for us in the building trades and we're sort of where our world. The Workers' Mic is, predominantly blue collar. There's a stigma attached to going to see a psychologist or getting mental health help. And, can you speak to that a little bit?
Sure. Yeah. So, one of the things that really attracted me to Premise, among a number of other different service delivery models, is its kind of integrated nature. So, there is, admittedly, a lot of hurdles in terms of getting a referral, getting an appointment, going to sort of a brick and mortar specialty mental health clinic facility or even virtually. It can be enormously advantageous, actually, to take advantage of services from a social worker, a counselor, or psychologist inside the same building, where you would go for an annual health checkup or where you get your hypertension medication, that sort of thing. I think it makes service for behavioral health a lot more palatable,
right?
And it's a lot more convenient. It's easy to access.
And it takes. Does it take the stigma? I think it takes the stigma away a little bit, because you can be going into that doctor's office that just use. Any one of the MCL unions, the carpenters, the electricians, the operators, we all have our own health centers. You could be going in there. The guy that's sitting next to you in the lobby has no idea why you're there.
Right.
And you could be going in to see, a behavioral health specialist, or more importantly, you could be going in to see, the doctor for your checkup. And they ask certain questions, and they say, hey, maybe you should walk down the hall for a second and go see Dr. Dell.
Right.
right? I mean, does that happen in your
Yeah.
world, doctor?
That's exactly it. Yeah, oh, absolutely. So, I'm fortunate to work with just some of the highest caliber physicians and mid-level providers I've ever worked with at my site in particular. And so, many of the folks that are established in care there, they really trust and respect and have a history with these docs. And therefore, there's just instant credibility.
Yeah, absolutely.
And then there is that anonymity, right? It's sort of like I can come check in for an appointment and nobody really needs to know why I'm there. Now, what's interesting is once they get back into our office, oftentimes the conversation starts with something that's painful and present, So it is, hey, I've got insomnia, I'm not sleeping, or it's, I'm drinking a lot, or I need to quit smoking, I need to lose weight, I have sadness or anxiety, or even,
Did you look through my file?
Yeah, exactly.
Wow.
Exactly. I won't get into the dream analysis we were doing earlier, but
Stop trying to get free treatment, Ken. Come on.
Yeah, exactly. Exactly. What's so fascinating though, as a man, just as a human being, I think oftentimes people are there and we start the conversation there, but I think what is the true gift of therapy for me, and why I've been so fortunate to work in this field for 20 years in different ways, is very quickly you start focusing on, all right, these things are here, and what are they costing you?
Right.
It's not so much like the painful stuff that's there, but like what's the avoidance and the stuff you're missing out on in terms of
like not going
engagement,
to your kids,
relationship,
not seeing your kids play baseball because you're laying on the couch because you're hungover,
or just
you're anxious,
not waking up happy.
Yeah, right. And not maybe not being able to get up to go to work, or being late, or what all these plethora of issues. Full disclosure for everybody that's listening. My family is a family of social workers. My mom, to this day has her own practice. And, I've been in and out of therapy pretty much my entire life.
Yeah.
And I hate to say it, but it works.
I'll tell you the same. I mean, I've got no shame in my game. I've, throughout my life, gone in and out of therapy, and I'd recommend it to absolutely anybody.
Yeah, it's just like going to college. There's no real downside to it.
No.
Right? What's the worst that can happen is you talk through some things, and
For sure.
that's it. But back to the behavioral health and how Premise does it. You guys are different, right? So you're not sending somebody out and going, okay, I'm going to give you a referral of these 3 providers and go pick one, and we wish you luck.
Right.
You're actually combining that with the service that they're getting at Premise Health Centers. Period. Correct?
Yes, sir. Yeah, and if you've got listeners that are a little unfamiliar with what normative expectations would be, the reality is, like, from a prevalence rate standpoint, about 1 in 8 people globally have some kind of diagnosable mental health condition. That might be mild or moderate, but that's almost 1 billion people. Furthermore, when people engage in therapy, if it's effective, we usually know it really quickly. And so you would get linked with a behavioral health clinician who's going to offer evidence-based therapy, so like something that's informed by science and happens in the context of that medical facility or their virtual opportunities if folks choose to take advantage of it that way. And really by 5 or 6 appointments, if it's going to be effective, it probably has been. And some of the biggest predictive factors for like who gets better in therapy and why are, folks that seek it out voluntarily. So, I mean, I've certainly had the experience in my career. It's like the judge sent me here, or even worse, like my wife sent me here. It's like, okay, this is a lot to overcome, pal. But also it's like, hey, how motivated is this person? And also most critically is like, the relationship between the person giving the service and the person receiving it. Like, does this person seem compassionate and competent enough to be useful? And I've worked with people all over the enterprise as a champion within the behavioral health line of service, and there's just extraordinary men and women that work in our organization. But that's a really critical piece. So I always encourage folks. I used to encourage Marines and pilots in the DoD as well. It's like, listen, if you meet with somebody, social psychology would say you're sizing them up within the first few minutes.
Right,
and if it just doesn't feel like a great fit, then that doesn't mean that therapy might not be a good option. It just might not be the right time or the right person.
Right.
And
so
you
you just pivot.
And first of all, nobody wants a suicidal pilot. Do you guys go back then ever, doctor, and go to the primary care physician and say, look, I recommend, therapy, talk therapy, right? But I also would suggest maybe that they get on, what do they call them? SSRIs. I'm sure I'm going to butcher all that, but an anti-anxiety medicine or antidepressant medicine or things like that. Do you try and do this holistically, I guess is my question.
Yeah, that's an enormous advantage of working in a place like Premise Health, is
Right.
that obviously there's careful confidentiality, so I would always ask for permission from someone who I was meeting with. It's like, would you mind if I, on your behalf, become a consultant to your doctor to recommend some lab work, recommend a sleep study, recommend a certain class of drug? Now, as a psychologist, I would never be the one prescribing that.
Right.
But what an advantage, right, to be able to say, let's take a multidisciplinary approach. You think about something like depression, for example. Sometimes people are very, very depressed because their thyroid is wonky, or they're very, very depressed because it's the time of the year and they don't have enough sunlight exposure. Other times people go through something horrific and they develop depression. But it's helpful for us to be able to take a multidisciplinary approach to optimize flourishing for folks as quickly as we can and kind of get them back to work and life where they can build a meaningful life.
So, I mean, I think what I heard you say earlier is that being open to the process, somebody being open to treatment, open to the idea of therapy, leads to better outcomes, leads to quicker outcomes. And I think that everybody's gone through something in their life where, they feel like they're just not feeling quite right. They're like a water bottle with the cap not screwed on quite straight. But being open to this and thinking about therapy in sort of a positive, helpful way is important. I think COVID did a lot to normalize therapy, where everyone was struggling more and there was a shortage of therapists because everyone was going to therapy. But another problem that created was it created long wait times to be able to get in to see someone, especially for kids. And there was some coverage on 60 Minutes a couple of weeks ago about the massive number of teenagers, especially teenage females, who are being admitted to the hospital for suicidal thoughts and things like that, because they can't get in to see someone or don't know to see someone. But when we're talking about a premise healthcare center, if you go in to see a doctor, they see something that's a problem, they can send you down the hall to a therapist right then and there. So you're eliminating this, I have to make a call, I have to find someone, I have to decide that I like them, and I have to make an appointment, then I have to show up.
To jump through all those hoops to do something that you might not really want to do anyway.
Right, you're taking all those steps out of it, which, let's be honest, if somebody's dealing with anxiety or depression, every step you add to the process is greatly enhancing the odds that they're just not going to go through with it.
Yeah. So Ed just basically told everybody your entire system for you. So thanks.
You're welcome.
Dr. Ed.
Dr. Ed.
So, Dr. Dell, all seriousness, what Ed said, I believe is true. And we talked earlier with Maria Romano, who talked about health equity and why premise is such in my opinion, a disruptor in healthcare, right? And it's a huge piece of it, because I know personally how debilitating anxiety, depression can be. Like, it affects every single aspect of your life. And you guys, kudos to Premise for realizing that you take this holistic approach, and it's not like we said. What do we call it? Doorknob medicine, right?
Door hanger medicine.
Yeah, the guy's got his hand on the doorknob and he wants to leave.
Next.
Next, and so the fee for service, and so you guys have this kind of holistic approach, which we think number one is smart. Number two, I also think it's working.
Right.
We've heard great stories from our members that use our clinics. And it seems to be working. So, what's your experience been like, with Premise? Do you think it's working on your end?
Oh, it's a tremendous privilege to work there, and again, like I would, having come from more of a Department of Defense background, which was very much integrated, behavioral health model. Where I worked in women's health clinics, pediatrics clinics, internal medicine clinics, et cetera. I would never want to work in a place that isn't built and structured like Premise. I do think Premise is more personal, more accessible. it allows folks to have more access with more value.
Right.
And the fact that it's kind of in many sites embedded right, co-located where people are for the most part, or just a really seamless virtual option.
Yeah.
Obviously, there's just tremendous advantages to that.
Yeah, I think you're absolutely right. You hit the nail on the head. Like it's a comfort feeling. It's comfortable to go into your own union hall and go to the doctor, right? You feel comfortable there, and like I've always joked, but I'm serious. Like at ours, at the operators, there's pictures of cranes on the wall, not clowns.
Right.
Cranes, not clowns. So listen, we gotta cut this off because we're running out of time. But I just want to say, first of all, if you just joined us, we're talking to Dr. Adam Dell. From Premise Health, and he's in charge of the behavioral health for one of the clinics out in Notre Dame. I think you made a bunch of really salient points, and if you're listening, if you have any problems, in this regard, or think you do, then
there's resources out there.
There's a ton of resources
Yeah,
out there.
don't hesitate.
Yeah, please don't hesitate. Call. Doctor, thank you so much for coming on the Workers' Mic. We really appreciate it.
Oh, thanks a lot, gentlemen.
Yeah. All right. Listen, we will be right back with more of the Workers' Mic right here on 720 WGN.
Welcome back, everybody, to the Workers' Mic here on 720 WGN. We certainly enjoyed having a couple of really interesting guests on the show today. What do you think, Ken?
That was awesome. Really, really informative and really different, And once again, I just got to say, and obviously we didn't invent this, but we certainly bought into it very quickly when we understood it, and now it's growing in leaps and bounds in labor around the country. But it's labor unions, entering into a different model of providing health care to their members and their families and making a difference. And I think an enormous difference. I know personally, you'll hear my story one day, but, an absolute difference in our members' lives. And it's unions doing it. It's labor doing it. You don't see it in the for-profit, corporate America world. You're seeing it right here. Working class people are doing it. So, kudos to the unions for doing it.
I do think that that folks who aren't a member of the union, aren't a member of the MCL, who took an interest, especially in some of the things that Dr. Adam Dell, the clinical psychologist, was talking about.
Yeah.
If I could leave everybody with one thought here, it's that if you've ever felt like maybe you need to talk to somebody, but you think that you shouldn't, or there's some reason that you're afraid to do it, just get out and do it. When it comes to mental health, life's rough, and sometimes you just need to talk to somebody. So get out there and do it. Check in with your kids. Make sure that they're doing okay. If they need to talk to somebody, make sure they have access to.
Absolutely.
But speaking of kids, what are you going to do for Father's Day today, Ken?
I'm going to watch TV.
Yeah.
And probably take a nap.
You'd call Evan a few times, and he won't answer.
Yeah, my son will be sleeping most of the day, but he tells me that I will have a gift coming.
Nice.
And I think it may have actually arrived yesterday. So he actually sent me a gift. And actually he called me this week too, which was really unusual. So I'm very happy. What about you?
I don't know. Emma says she has a surprise planned. And usually when she has a surprise planned, it turns out to be pretty interesting, pretty awesome.
Oh, that's awesome.
A very thoughtful, creative kid. So I'm just, whatever we do, I don't care what we do. I'm looking forward to spending the day with her.
You want to hear a couple of dad band names?
Sure.
Cialis and Chains.
These are names for dad bands?
Yeah.
Cialis and Chains. That's pretty funny.
The Who Left This Light On? Super Gramp.
Where are you coming up with these?
Tom Petty and the Heart Pacers.
Okay, I like it.
Let's see. Talking Heads with subtitles.
All right, I think we've reached the end of the good ones.
Last one, Depressed Mode.
I like that.
Dad Halen.
Well, thank you very much for that, Ken.
That was all from McSweeney's. I didn't make up a single one of those. I'm not that smart. And if you ever get a chance to read McSweeney's internet tendencies, it's just this little blurb, a blog, or
some of the funniest stuff on the internet.
Oh my God, it's flat out funny. So that's where I got that.
So we've got a wrap for the week, but before we do, Ken, you wanted to throw a shout out.
Oh yeah, listener of the week. Got a really nice phone call. Saying how much she appreciated, some of the benefits through the MCL, but then she threw in at the end. She's like, and by the way, I listen to your radio show every Sunday morning. So shout out to Dawn Nowak.
Thank you very much, Dawn.
Yeah, we really appreciate the support. Very, very nice.
All right, we'll be back with you next week right here with the Workers' Mic on 720 WGN.